I first heard about Sovereign on a TV commercial for depression and addiction. And I was very depressed and I was addicted to alcohol. And I knew that I needed some help, so I desperately called the 800 number and talked to a wonderful woman who worked with me for a month to get me in here. And she moved heaven and earth to get me here. She was fabulous. I was really looking for dual diagnosis because I knew that it was the depression and the drinking together, and I was really looking for that, and they met every expectation I had and more. The whole campus is beautiful, but the groups, the therapists, the house managers especially are just, they can relate with you and talk with you, and it's not, I was at another treatment place about 5-6 years ago, and this is like amazing compared to that. You have the support of so many people. You have a case manager, you have a therapist, you have all the therapists in all the groups, you have the house managers, and of course the other ladies are also very, very helpful. It was very nice. It was big, it was clean, it was comfortable, kind of homey. You had books and puzzles and games and things to do, and the campus was beautiful. It really was. Fabulous, all of it. The therapists are there, even if it's late at night and something's going on, you can call them. I had a nightmare one night and I woke up and I was like terrified and I was shaking and I was crying. And the house manager just sat with me and just talked with me and just calmed me down. And they're there all the time, the house managers, all the time. For any problem that you have, they're there to help you. Even if it's just sending an email to somebody else, but they talk to you. A lot of them can sympathize. They've been in our position, so they can sympathize, and that makes all the difference in the world. Like, been there, done that. I know how that feels. And seeing that they've been, in recovery for 10 years or whatever, gives you hope that that can be me. I can do that. All the therapists are really, really good. They're all very relatable. We get up early and we do blood pressure and stuff and have breakfast and have coffee, and there's a house full of food, so nobody ever wants for anything. Our group starts at 9. We have a group for an hour and a half. One of my favorite was the DBT, the thinking one, and the self-awareness was great. They ask questions of you that you don't think to ask yourself, and they make you more aware of why you feel the way you feel and things. So they were great. I considered every group that I went to, I took one tool away from every group and I put it in my tool belt. I have 8 more groups to go before I leave, so there's 8 more tools to put in my tool belt before I go. It's a very caring program, and they really look out. You're not just a person in a rehabilitation center or whatever. You're a person. And they treat you individually as a person. You're not a patient. You're a person. And I wasn't just somebody in a group. I was Janice. And they knew me, they knew my story. It was like talking to your own personal therapist every day. But then you have your one-on-ones with your therapist as well, but even in the groups, they know you. It's not somebody in a room. It was great.